Many scientists have expressed concern that the easing of restrictions at Christmas could lead to another surge of COVID cases in January. With cases still over 80% of the level at the start of lockdown, is the Secretary of State not worried that allowing outdoor events of 2,000 participants and indoor events of 1,000 in level 2 high-risk areas could actually drive up infection rates ahead of Christmas? While the lateral flow testing is very welcome in how it increases capacity, the Secretary of State previously stated the mass testing in Liverpool was a pilot and would be evaluated before being rolled out elsewhere. As the city has also been under tight restrictions and then lockdown, how will the impact of mass testing alone be evaluated? How does he plan to counter the lower uptake among deprived communities, the very ones at highest risk, seen in Liverpool? And with no clinical evaluation yet published, how can he justify putting out contract tenders for an eye-watering £43 billion and rolling out this approach to 67 other areas? Should this strategy not be compared with investing money and energy in getting the traditional test, trace and isolate system working properly? Currently, over 40% of contacts in England are still not even informed they should be isolating. Finally, he knows it's not testing, but isolation which stops the spread of the virus. And if people who are infected or could be carriers are not isolating, no amount of testing will stop viral spread. The study by King's College, which suggested less than a quarter of people were isolating when advised, was incredibly worrying. So what assessment is the government doing to clarify current isolation rates and understand the reasons why people may not follow the advice they are given?
Thank you very much, Madam Deputy Speaker. Well, of course, we're constantly evaluating the impact of people isolating and how many people isolate when asked to. I would just encourage the Honourable Lady to look at a broader range of studies than just that one from King's College, and especially when you look at the self-isolation of those who test positive, which does tend to be higher. She asked about the use of these lateral flow tests to have a negative impact on the number of cases in an area. Of course, we've been evaluating this all the way through the study in Liverpool, and that's why we can have confidence in rolling it out more broadly across Tier 3 areas. I included in my statement a high-level assessment of this, which is that if you look at Liverpool City region, the number of cases is down by 2/3, but in the city itself, where the testing took place, it took place of people who live in the city and of people who work in the city and live largely in the wider city region. The number of cases is down by over 3/4. Now, that's one piece of evidence. It is clear that it's the combination of people following the rules and the community testing put together with the appropriate incentives to get people to take up the mass community testing. That is what can help to make this work, and we want to work with local directors of public health to understand and to know how this can work effectively in their areas, precisely to reach the hard to reach that she mentioned. Finally, I would echo, Madam Deputy Speaker, the request from the Honourable Lady that we be cautious this Christmas. But I would say to her that having agreed an approach across the whole UK, including with the SNP government in administration in Edinburgh and with the Welsh Labour administration and the cross-party administration in Northern Ireland, I'm delighted that there is an approach all the way across the UK, because there are so many ties that bind us together, which mean that we are stronger as one united kingdom working together to tackle this virus.